and there will be a period of question at the end. So people who have got questions about things we are talking about can just use the little function on their screen, which is like a forum, a little box at the end. We'll show you where it is later. So we will take the question at the end, but you're welcome to ask them as we go along, and we'll collect them to discuss. Unfortunately, we cannot hear you. You can only hear us, so we'll have to read the question. We will read them anonymously, and we will answer them as we can. So you can see here, actually, it's all the partner of the project. So thank you, Valeria. So just to tell you a little bit about where we started that project. We started that project in 2016. So we knew some of the information about parents of trans kids, because obviously, you know, we've talked about it, you know, more and more and more as time progresses. But what we knew at the moment is that, you know, reaction when a child is doing his coming out, sorry, or is kind of affirming their gender identity to their parents, we can expect like a range of reaction from the parents, from expression of love and affirmation to negative reaction. We also know that lack of parental support or family-based rejection, as well as stigma and discrimination, are detrimental to the health and well-being of young people. When we look at young people's well-being, we see that young people who are affirmed by their parents and strongly supported have got like an overall greater quality of life. And studies show that education and clinical and or peer support are elements that allow parents to adopt affirming practices. So often when they start, they don't really understand what is going on, and it's through education that parents can start really following their child. At the beginning of the project, what we did not have is a lot of information on parents who do decide to go with their children and accompany them into getting gender-affirming care. When we talk about gender-affirming care, we're talking about care that are given in clinics to have access to puberty suppressant, hormone therapy, or surgery. So what we didn't have really was the information about what's the experience of those parents, because it's one thing to understand and accept a child, it's another thing to take them to clinics. So we wanted to kind of get like an overview, a better understanding of what is the process that parents are going through. And the main concern that we knew so far was related to lack of resources, safety, acceptance, and step of transition. But this literature that we had was for parents who are not in clinics. So they were like, you know, literature about parents overall. So we didn't really know about, you know, those parents who are into the hand of a gender-affirming provider. So the study objective was to learn about the experience of youth and their families. And now you'll wonder why youth and families, why we're just talking about parents, is because we looked at the data that we gathered from parents, and we looked at the data that we gathered from youth, and we put them together a little bit later. So today we're just going to focus on what's going on with parents, but the whole story was to understand the motivation and pathways leading youth and family to seek gender-affirming care, strategies used to express and or address dysphoria, and to navigate social and family situation, and the aspect that contribute to psychosocial well-being and quality of life. So how we did that, I'm going to go very quickly over that, but some people might be interested. We use like a project that is drawing from what we call grounded theory. So what we wanted to do is really start from like the experience of participant and build the understanding based on that. So we didn't start the project with like a theory that we wanted to apply to what we found. And we were kind of very aware that there might be some differences in terms of who these parents are and who those families are. So we wanted to have an awareness of possible inequality between different social determinants. So we use the social determinant of health, which look at, you know, is there inequality in terms of like wages, in terms of social economic background, race, gender, etc. So we had that in mind. And what we did is that we recruited parents and their child in 3 different clinics across Canada, and they are specialty clinics. So they are clinics that just work with children who have experienced gender dysphoria, transgender children, or gender diverse kids. And so they are very specialized in that. And those clinics are Meraki Health Center. If there's people in Montreal, you'll probably know that clinic very well. We also have the Children's Hospital of Eastern Ontario that participated in that study, and the Health Science Center in Winnipeg. And so we collected data. To participate, we needed to have like the agreement of the parent and the child. So we did 72 semi-structured interviews with 36 child-parent dyads. So we tried to get like a variety of people, and the child and the parent were interviewed separately, not because we wanted to compare necessarily if they were saying the same thing, but more to give like the space of each of these people to be able to really tell us about their experience. And after that, what we did is that we looked, and we also asked them to fill a demographic questionnaire to understand a little bit about who they were. So we're asking questions about age, about wage and ethnocultural background and that sort of things. And then we looked at the data and we tried to analyze it and see what sort of theme came out. So we're going to talk about it in a minute. Oh yeah, so here you can see basically what is the sample, so who participated in the clinic. Now here we've got just 35 because we had 36 dyad, but we didn't include that in that analysis. It's a diversity sample, so we're sampling the children. So the parents who participated in what we're presenting today, they were not sampled. So we didn't look for the parents, we looked for the children. The parents just tag along. Okay, and what we had in a sample basically, so we've got 32 mothers and 4 fathers. You'll say, well, that's equal 36, is because there's one family who decided to do the interview together. So it was still 35 families, and 29 of these families were covered by private health insurance. And here you can see on the right the different like educational achievement.
So what we're going to present to you today is actually a part of the preliminary analysis that we did of the data. So that was before the 36th parent joined the sample. And what we're going to show you here, so this is kind of like a quick glimpse of the presentation, and basically what we're trying to put an emphasis on is that the fact that the acceptance process and the journey that parents go through is anything but linear. So we may think that parents who are in clinics have already reached a certain point or a certain level of support and acceptance, but sometimes it's not necessarily the case. So we're going to start off with the parents' perspective of their child's coming out. And just excuse me one second, I'm having trouble seeing my screen. Whoops, there you go. So the parents' perspective on their child's coming out. So this is actually something that marked the beginning of their journey and was seen as a very important moment in their life. And we cut up the reactions that parents may have had to their children in a few separate categories. So before we get into that, we just want to quickly emphasize on the fact that while we divided all emotions and reactions into a few different categories, obviously parents went through various emotions and experiences throughout their journey. So as you can see, the first reaction that we identified was disbelief, and disbelief manifested itself through 2 different ways. So the first one was disbelief as the result of being overwhelmed. And this was essentially the case of parents who felt like they already had enough on their plates. So they had other difficulties that they had to deal with related to their child. And as you can see here from Franca, parent of a trans feminine 17-year-old, who says, so one night, and here you will see that the pronouns that are in the quotes are the ones that parents used, and some of them were still misgendering their child at the moment of the interview, but out of respect for their children, I will use the correct pronouns. So as Franca was saying, so one night, she sat down next to me. She said, "Mom, I'm not well at my body. I'd like to become a girl." So then my reaction was being angry, because ever since they were little, both of my kids, they've had a lot of, ADHD, medical follow-up for their ears, medical follow-ups for their eyes. It was always me who was taking care of everything. So I'm tired. I'm a tired mom who's excited for her kids to be more independent. I wasn't well, so I was a little angry. I said, it's time, it's money, I'm fed up. And the other kind of disbelief that we identified was actual genuine doubt. So this was the case of parents who really couldn't believe that this was something that was happening to them, and really it wasn't something that they could ever see coming. So as you can see here, from Kylie, who said, and I said, and of course my reaction was like, it wasn't a good one. It was, no, this is how you were supposed to be born. And like, just because you like girl things doesn't mean you're a girl. It's okay to like both things. And it was just like, I don't know what to do. And I was just in a panic. So some parents were describing themselves as kind of freaking out when they found this out, and they really didn't know how to react either than just completely deny it, sometimes directly to their child. And of course, some parents were describing feelings of surprise when their child first came out to them. And as you can see here, coming out was unexpected regardless of presence or absence of previous signs of gender nonconformity. So some parents essentially told us that they saw certain signs, whether they identified them as some kind of signs or whether it made sense later on. A lot of them were very surprised to learn that their child was trans. So as you can see here from Jesse, who says, I was surprised. It wasn't something that I was expecting from him to say to me, but at the same time, it wasn't heartbreaking or conflicting for me. So surprise wasn't necessarily associated to negative feelings. It was sometimes simply just the fact that parents weren't really aware that that was something that was possible. And also, as we were saying earlier, some parents actually saw certain signs or indicators that their child manifested to them something that was related to gender nonconformity. And the fact that some parents were finally able to piece the puzzle together generated positive feelings and reactions. So essentially what happened is that once the child came out, especially in the cases where a child wasn't feeling well or was dealing with a lot of difficult things prior to the coming out, parents felt like it was finally an opportunity for them to understand what was happening and to know how to help their child. And as Mira says here, he just slowly from puberty on, just slowly started pulling away, and then talked less hugs, just got really sad. And we didn't know what was going on. Like, we were taking him to all of these things and nothing was really working. It was pure joy to know that this is maybe what was causing it all. And of course, a lot of parents expressed that they had experienced feelings of openness and pride. And when their child came out, and as you can see here from Jackie, she said, I looked and I said to you, I'm proud that you are my child. I'm proud of the courage you had to express and to say what you were feeling. And I'm proud of the courage you displayed to move forward in all of this. So, you know, things considered and all the steps that are involved in making a transition process, whether it be a social, a medical, or legal transition, parents felt like their children were displaying a lot of courage, and they were very proud of them. So we're also going to go over some of the interpersonal struggles in accepting the child, the transition, the process that it entails. So a lot of parents were struggling with a few things, and one of the main themes that came out was that coming to terms with the personal and social struggles that come with being trans, including the child's safety, was something that was very difficult to navigate and kind of come to terms with. So it wasn't necessarily the fact that their child was trans or wanted to transition in some kind of way, but it was really just the fear and the worry that their child may be facing a lot of difficulties in their lives, such as discrimination and violence and intimidation at school. So as Alma says here, I think no matter what your child was going through, you wish they weren't. That doesn't mean I wish my child wasn't transgender. I just wish my child didn't have to go through what that entails. Then, excuse me. So as we were telling earlier, disbelief was a part of some parents' initial kind of reaction to the child's coming out. And for others, that disbelief extended itself into the acceptance process. And that disbelief and denial was really related to the child's identity. So as we can see here from Maika, who says, I said, maybe if it takes a little more time, youth can realize it's not that they're not trans. Maybe he's going to come and he's going to say, you know what, I'm a lesbian. I secretly realized it would be so much easier to say I'm a lesbian than to say I'm transgender, because being lesbian doesn't involve any hormonal surgeries and physical change. And for others, that type of disbelief manifested itself through grief and mourning. So many parents actually expressed having feelings of grief and mourning their child, whether it be mourning the name that they have chosen for their child, the kind of relationship they were hoping to have with them, or things that they have envisioned for their future, or and for some it was actual literal grief over the loss, like the physical loss and even death of their child. So as we can see here, a quote from Edith, a parent of a trans masculine 14-year-old and also a parent of a non-binary child who wasn't interviewed in this study. So she says, so I find myself with the loss of both of my daughters because both of her children were assigned female at birth. I had 2 daughters and me, I wanted to have girls. So my grief at the moment is that, you know, not to go shopping with my daughter, to go do our nails, or, you know, you understand? So she was kind of mourning the mother-daughter complicity, the relationship that she was hoping to develop with her children. And other than that, this disbelief also manifested itself through concerns about regrets. So it wasn't necessarily that the parents at the moment weren't believing the child, but they were actually worried that their child might change their mind, especially in the context where they are now having to take, you know, make decisions for their children who haven't reached the age of consent. And they were worried that maybe one day when their child is older, they will actually realize that this wasn't something that they were supposed to be doing to start with. So as you can see here from Steffi, a parent of a trans masculine 13-year-old, who says, because those aren't reversible, and she's talking about the medical transition specifically, because those aren't reversible. So I just think that he's way too young to make that decision. Youth maintains that this is not a decision. This is just something that is. This is who he is, and this is the next step. So I see it one way and he sees it completely a different way. So I'm not there yet. And I have to make the decision, right? And then live with the consequences of it. And then I don't want to have a 25-year-old or a 30-year-old saying, why would you let me do that? I was 15 years old. I think that's my biggest fear. Also, related to transition process and what it entails, some parents were actually describing feeling overwhelmed by all the steps that a medical transition entailed. And as you can see here from Barbara, who says, but I was like, but yeah, but now what, you really want to change everything? You want to change your body? You want to go through a full transition? And she said, yes. Hey, it's really a lot. It's too much for me to process. So it was essentially a parent who was feeling very overwhelmed with everything that had entailed and how invasive some of the procedures were, even if the child was very certain and very confident and very comfortable with going through all of that. And for some parents, this feeling of being overwhelmed actually came with feelings of resentment, because some parents who had older children kind of reached a point in their parenthood where they felt comfortable with what they have achieved. And it was, for them, it was, you know, it represented a time in their life when they could finally focus on themselves and just let their child just be and live their own life. And they felt like their parenting job was essentially done. So as Brenda says here, I mean, there was a little bit of resentment to start with, because this year was meant to be my year of self-development. And then it all just fell out the window, really, because my mind is completely redirected to my kid again. And excuse me, and also concerns that were expressed that were related to specifically the effects of medical transition on the child's health, such as mood swings, loss of fertility, surgeries being very invasive procedures, and long-term effects of hormone blockers and HRT, especially related to things like cancer. So these are parents who felt like there wasn't enough research, or that they weren't aware of enough research on the long-term effects of these medical transition means. And, you know, all this being said, obviously not all children in general want to go through a medical transition, but these were parents who were in gender-affirming care clinics, and all of their children were kind of expecting that. So these concerns were pretty frequent among the sample of parents. Also, one of the struggles that parents went through was struggles using the child's new pronouns. So while most parents were using the right pronouns at the moment of the interview, many mentioned having struggled in the past. And as you saw before, some of them were still struggling when speaking about their child. And a few were still, misgendering the child. And also, in one particular case, it was used to wield power over the child. So in general, the misgendering obviously wasn't intentional. And in most cases, it was just a matter of rewiring something that was deeply coded in the brain, as parents were used to calling their child a certain name with a certain pronouns for so many years. And it was just a matter of time to readjust to a new vocabulary to use. And also something that we noticed was that many parents, most of them were in co-parenting situations. So they were either living with the other parent of the child, or divorced and somehow still in touch, very frequently or not very frequently with the other parent. So in the co-parenting struggles, we have identified two types of co-parents that parents were struggling with. So the first type is when a co-parent was unaccepting and therefore did not engage in the transition process. So this was essentially the case of, parents who did not accept the child's gender identity at all, and obviously did not want to get involved in the transition process. So as we can see here from Donald, who's a parent of a trans masculine 16-year-old, he says, at the beginning, my wife, she was taking care of the appointments at the clinic, but she pulled out. I think it was too much, maybe too much emotion inside her. She didn't feel comfortable. For instance, I'm taking care of the papers for the mastectomy, and my wife, I had to force her to sign the papers. She didn't want to sign. And that was actually the case of a mother who, even though she seemed accepting and involved in the beginning, she had to pull away because she was dealing with a lot of feelings of guilt and responsibility, when she was facing everything that was happening. And the second kind of co-parent was the co-parent that was neutral but uncommitted. So accepting their child gender identity, but not helping throughout the process. So as Jessie says here, is that supportive? I feel like I do everything because I do. The psychologist, for example, that we sought out ourselves, they wanted to meet him. He wasn't interested in doing that. He's like, I'll sign the consents, I support youth, but he doesn't go to appointments. So it's a parent who says that they accept, that they don't have any trouble with it, but they don't want to be involved in any way. So they don't read about it, they don't get involved, and they don't go to appointments. And obviously single parents recounted being affected in a similar way, in the sense that they felt very alone in this process and they didn't have another parent to bounce this off of. Of course, there were aspects that were facilitating the acceptance process. So not everything was negative. And obviously, inevitably, time was identified as a facilitator of the acceptance process. So obviously, like we said with the pronouns earlier, time was a very important factor because it just takes some time to readjust and to relearn certain things and to deconstruct certain perspectives that we had in mind. And actually, some parents even spoke about the timing of their child's coming out as an important element in the transition process. So some of them felt that maybe if their child had came out earlier, it would have made things easier. So the process would have started earlier, and that would have facilitated things for them and for their child. So obviously, lack of prior knowledge and information was described as an element impeding the acceptance process. So it was essentially parents who either have never heard of trans-related anything, or have never even heard the word, or never had any access to any kind of information on the matter, had more trouble understanding what was happening. And of course, when you don't understand something, it's very hard to accept. And indeed, becoming educated in trans-related issues facilitated the acceptance process. So this was essentially the case of parents who got informed through various sources, right? So it was either online or in books or through some TV shows, like documentaries on trans youth and people in general. And throughout this whole information and education process, parents actually realized how important their support is. And that's what we see in research, that parental support is actually very essential to a child's well-being. And as you can see here from Rose, who says, I explained to my husband that the suicide rate for trans kids is high, and that's not going to happen in our house. That's not an option, and that we need to support youth, and like no questions asked. And also through learning more about this issue, parents realized how allowing their child to socially and or medically transition will contribute to there being potential save their life. So as Jules says here, youth is making the decisions and we're supporting youth. And I think that's going to go a long way to help him with his self-esteem. And so that's related to his medication. That's, you know, he's dealing with the doctors now, he's having the say. And I think that's, you know, for his life, he's making the choices for his life as opposed to for his death, which is where he was headed. So as you can see here, this is a parent who, just like others, saw that her child wasn't doing well. And once the transition started, she could really see that it was contributing immensely to her child's well-being and mental health. So just like some parents had concerns about potential future regrets that their child would experience, others were certain that their child was on the right track and were very comfortable with everything that was coming. And as we can see here from Alberto, who says, I know initially he would change his look, shorter hair, different clothes, stuff like that. And then we're calling him by pronouns and different name. I imagined way back, I just imagined him going directly from girl to boy. It was a lot. I was worried about that, especially the thought of surgery, because the surgery, you know, is for them seemed like a very invasive process. One, I guess it's so permanent. And then eventually I realized, okay, yeah, this is a thing. It's real. He's not changing his mind. No, this is the right call. And among, you know, all the other positive feelings that parents could have experienced, regardless of if they experienced disbelief at the beginning or surprise or feeling overwhelmed, many parents said that they were actually excited and sometimes relieved about crossing transition milestones when things were actually moving forward, especially when they saw that it was contributing to their child's well-being and overall happiness. And obviously, we again have feelings of pride where parents felt so proud of their children to overcome their fears, such as fear of needles when it came to hormone blocker injections and stuff like that. So they were very proud of their children to not only come out to them, but also face everything that was coming. And inevitably, support was something that was very important to all parents, actually. And as we can see here, being in contact with other parents of trans children and youth, either through support groups, so in-person support groups in their areas, or online support in some private groups on Facebook, for example, it was very important for parents to facilitate their process, not only through, you know, sharing knowledge and experience with others that were feeling the same way and going through the same experiences, but also they said that they were able to acquire certain tools to face some difficulties that were involved in the transition process of their child. So as you can see here, Mira says, resource put me in contact with a wonderful lady whose son transitioned about 10 years ago. And she's basically been our angel. She's guided us through what to expect next. She kind of gave us the heads up that youth might want to change his name. And then he kind of mentioned when I think I'd like to change my name. So it was helpful because then it wasn't a complete shock and I was able to just be more, supportive. And when it came to support, so on one side, there was the peer support that was very important, but for others, it might have been not the best choice for them. So while some seeked both, others were more inclined to seek professional support, especially individual support. So on one hand, we had parents who seeked professional support for reinsurance regarding their child's gender identity and or medical transition to, as you can see here from Shirley, a parent of a trans feminine 14-year-old who said, it reassured us because I was worried. I didn't have any signs I was telling myself, what's the deal? Is this just a phase? And the psychologist told us, no, no, it's not a phase. She reassured us. So some parents needed to know for sure that this was a thing and that this was real, while others seeked emotional support for their own needs. So therapeutic supports for personal needs, excuse me. So as we can see here, Jessie says, learning to reach out for support has been a big part of my experience because I've gone to counseling myself, because there are a lot of conversations you should not be having with your child. You have to get your own individual support. So instead of relying on the child to, let's say, support them through this process and kind of help them digest their feelings and face them, some parents recognize that they need to get their own support in order to be more supportive of their children. So speaking of professional support, we also looked at what brought parents to the clinic, how they even found out that these clinics exist. So most parents discover the clinics while searching for information and support following their child's coming out. So this is during that education and, you know, self-education process where parents were looking for information. They found out about the clinics online, and others, it was either through a referral from a healthcare or mental health professional. They were consulting either related to that or in another context, through an LGBTQ or trans-specific advocacy organization, through a child's school, from counselors, for example, or through other parents, or when a clinic was mentioned on a documentary show on TV. And the reasons for seeking clinical care were, in general, to better understand the necessary steps for the transition process. So really know what it entails and what to do with it. Also to improve their child's well-being through gender-affirming care, because most of them have realized that this was something that was essential for their child's well-being. And also a few parents actually mentioned that it was at the specific request of their child. And this was the case of families where the child was older and had time to, well, had access and time to research things themselves before even coming out to their parents. So they were very clear about their intentions and needs regarding their transition process. So overall, the experiences at the clinics were described as generally positive. When it came to care accessibility, around a third of parents said that their first appointment came quickly. But this is something that we need to look at with precaution, because as you can see here, the perception of time vary depending on each family's and youth situation. So for example, for those like Steffi here in the quote, who says that they started the transition process very early on and puberty was way ahead, they didn't feel like the wait was long because there was no urgency to start, versus someone who has a 14, 15, 16-year-old child where puberty has passed and they feel like they have to act faster. The waiting time, the perception of the waiting time varies a lot. And also following intake, booking appointments and accessing different professionals was described as quick and a simple process. So once they were already in, booking appointments with different specialists like endocrinology and psychosocial services was actually very quick and easy. And for certain parents, actually the waiting time for endocrinology seemed very appropriate, because not only it allowed the child to really take the time to take the information in and make informed decisions regarding their own transition and body and however they wanted to go about it. It also allowed professionals to assess and evaluate if this was actually sorry, I'm starting to get confused, but if this was something that was appropriate for the child. And for families with older youth, the clinics facilitated access to further gender-affirming interventions, such as surgeries, because these were not offered at those sites, so they had to be referred elsewhere. So overall, parents described staff as knowledgeable and felt like they guided them towards informed decisions without pushing them into something they weren't comfortable with. So as we can see here from Deborah, a parent of a trans feminine 14-year-old, who says, I think we're surrounded with a good team. I think they're educating us. We rely on them, you know? It's the same thing as we're having a new program, right? Like, I know I have a little human. I know how to be a parent. I know how to love my child. But as far as what to inject in her for her to be who she is, our faith is in the people's hands who know and who study this and who've gone to school a long time. And also parents felt generally supported and comfortable discussing concerns and asking questions without fear of being judged. So they felt like professionals and specialists were available, and they were good listeners when it came to expressing their concerns and needs regarding the transition process. On the other hand, there was some criticism and some challenges that were faced by a lot of the parents. And again, when we go back to waiting time to access care was longer at one particular site, or it seemed longer at other sites for parents. And waiting time was also significantly extended in one case where a youth was rejected multiple times due to protocol restrictions. So this was a youth who had already reached puberty but wasn't old enough to access a hormone replacement therapy at that specific clinic. So as Sophia, a parent of a fluid transmasculine says, the clinic still rejected him, and he was like, well, I guess you'll have to wait. And you guys insane talking about you read any of the documentation, you don't fucking wait. You know what I mean? And at the time, and at times of extreme frustration, probably closer to rage, you know, I often think, do I send the funeral bills to the clinic? So this is a parent who was very concerned about her child's mental health and well-being because of lack of access and actually gatekeeping to gender-affirming care. And she was very concerned about the consequences of that on her child. And other than that, there were also some issues with scheduling and scattered appointments. And some parents felt like their child had to miss a lot of school days in order to attend all of these appointments because they were scattered throughout the week or throughout the month. There was also a significant lack of mental health services for children and youth. So it was it was mostly focused on the medical aspect of it. And the specialists that were consulted were mostly doctors and endocrinologists, etc. And other struggles identified by a handful of parents were related to language barriers, lack of support resources for parents, and the feeling that some needs and concerns were belittled by staff. So the lack of support for the resources for parents was very important one, especially when we saw that so many parents were actually seeking that support for themselves. And this is one of my favorite quotes, I think, through all the interviews, where Alma, a parent of a trans-masculine 10-year-old, says, the biggest lesson that I learned, I think that the most confusing part, it's not confusing for me to have a transgender child. That's not confusing. It was confusing to me when my kid was really young and saying, I want to be a boy, I am a boy, and you don't know what the right thing to do is, you know? What doctor told me was that you'll never hurt them with love. So you follow their lead, do what they want. They want to cut their hair off. They want to wear all boys' clothes. They want to wear a dress. You never, ever, ever going to hurt them with love and acceptance. And I think that was the biggest lesson, was love and acceptance. Acceptance doesn't hurt anybody. So just to wrap up everything that we just presented, so the process that parents go through before accessing the clinic, or even while they're still at the clinic, is complex and long-winded, but can be facilitated by four main pillars of acceptance. So obviously education, so having access to trans-specific knowledge and information. So also time, so having the time to, you know, learn all these new things, rewire certain concepts in your brain and get used to this new reality that your family is facing. Also support from professionals, either for personal needs or for needs related to the transition process specifically, and also support from other parents. And as we can see here, the lack of support from professionals was an important one, especially in the context where parent-centered support actually equals to, well, is very essential to youth's well-being. So that was something that we wanted to highlight. And just before passing the microphone to Annie, we just want to highlight some limitations of the study because, you know, just like any other study, there are some limitations that need to be brought up. So most of the parents in our samples were white, and although some had a child who was Indigenous or racialized, most of the parents were white. So this doesn't necessarily represent the experiences of parents who, parents of color or Indigenous parents or migrant parents that were non-white. And so we can't really speak on the experiences of those families. Interviews were also conducted in clinical settings. So the interviews were conducted in the clinics. So obviously this means a lack of representation in families who consult other types of resources because they weren't recruited there, who do not support their child's medical transition, or those who do not wish to participate in the studies. And inevitably, qualitative data isn't generalizable, but does reflect the lived experiences of those who took part in our study. So we can't apply these results to all parents in general, but we still have a very good glimpse of a good sample of parents who consult these resources.
Yeah, so just to wrap up, so that data, we have talked about it in different conferences. We're trying to kind of disseminate in different forums like webinars. We've written some articles about it. You are welcome to have a look at the website gender-affirming.ca. We have written some fact sheets, summarize the findings, and it's finding about that study, but also other study that we are doing. And perhaps just tell you a little bit about other thing that we're doing now is that today we had like just the theme about the parents interview. Tomorrow, if you're free and you want to join, you can come to the webinar where we're going to talk about the youth experience. So just
in French, right?
In French, yeah.
Yes.
French, but actually you will soon be able to go onto the website to get the English version of that webinar that's going to be available all the time. But perhaps just one thing about what we're doing now with the data is that we started kind of gathering it together and looking at it, putting that into a dialogue. And so I would just perhaps make one observation when Valeria was talking about accessibility and the perception that most parents felt that it was fairly fast to access services, except perhaps something. When we put the data together and we look at parents' experience versus kids' experience, we realize actually that there's like an important asynchrony between needs and between perception, because youth will say, well, this was too long, you know, it was not fast enough. And so we need to be careful, and maybe I will just conclude with that, and that shows why it's important to do research that look at the parents and the child together.
Yes.
We need to be careful because parents' experience are valid, are important. They give us information about how they process things and how they progress through a journey. But they are not always faithful to the kid's experience. And what we see is that the child might experience something totally different that the parent is not even aware, and for a long time. And so we see that there's a long period of asynchrony between those two, and they finally join at some point, but sometimes it takes time. So we will organize some more webinar in the near future, to tell you about those wonderful data that we are putting together. But yeah, so we've got like different articles in progress. We've got master student doing project. We've got like future research project as well that's coming. So please visit the website for more update. And now I think it's going to be time for question. We've got 15 minutes left. Thank you, the CIHR, Canadian Institute of Health Research, for the funding of that project, and for all the people who's provided feedback and work on the project that we didn't name all. I think we've got the last slide with...
yes, right here.
Here you go, with all the people who work on that project, so we can properly acknowledge them now. So maybe you want to just go back to how to ask questions?
Yes. So